Today we have the honor of speaking with Dr. Mehul Shah, the President-elect of the Indian Medical Association Gujarat for 2024-25. Dr. Shah is an esteemed orthopedic surgeon with a long-standing commitment to serving the community, particularly in providing free surgical care for disabled children. He has dedicated over 25 years to the Apang Manav Mandal and has been involved in numerous charitable organizations and medical camps across India. Dr. Shah is also a pioneering force in the field of orthopedic surgery, introducing innovative techniques to improve the lives of patients. Let's explore his remarkable journey and contributions to healthcare and the community. First of all, a very warm welcome to you, Dr. Shah.
Thank you, madam.
What brings you to New Jersey?
There are so many things and so many doctors here and so many friends here to bring me to the New Jersey, and many things to attract in New Jersey and the USA. There are many our doctors friends, non-medical friends here in the USA. So that is a very win-win situation for me to meet every doctors and every non-medical friends. It's a very good experience in USA.
Can you share your journey into medicine and what inspired you to specialize in orthopedic surgery?
My journey starting in '83 in medical schools when we are studying in Ahmedabad in NHL Medical College. Then we have entered into the orthopedic surgery department in residency in '89 to '92. And then I have attached with my uncle, Dr. M.T. Mehta. He is a renowned orthopedic surgeon. And another two doctors, Dr. J.P. Pandit and Dr. Prakash Amin. They are the very nice person, the good mentor and excellent. They are doing the philanthropic activity in Gujarat state. That drives me, and along with that, Dr. Bharat Bhagat, he is a main mentor of our philanthropic activity. Then I have driven into the orthopedic as well as the philanthropic activity across the Gujarat, not only the Gujarat, across the India also, to treat all the disabled patients, disabled children, and many camps we have done in so many years. That's driven me this area.
So you've dedicated much of your career to serving disabled children. What motivated you to start working with the Apang Manav Mandal, and what impact have you seen from this work?
Before 2-3 decades, there are many patients of disabled patients in the polio victimized patients. They have residual polio and many deformities.
We don't have polio.
But right now we are not in a single polio. But during that days before, I am talking about 30 years before. So at that time there is residual polio, and there are so many difficulty and disability during that days, and we have corrected so many deformities and make them able to walk in their surrounding and in the world. But from there, I have journey starting from all the NGOs across the Gujarat. There are so many NGOs in the Gujarat state. They are working for the health structure. More than 100 health NGOs are working in a different aspect of the field of the medicine. And they are serving all the parts of the Gujarat and rural parts of the Gujarat. So we are, as IMA, Indian Medical Association Gujarat, is connected with all the 100 or more than 100 NGOs across the Gujarat. So it's a need of the society and the need of the community to serve rural part and the need of the health structure. That is our wish.
You were talking about 30 years back, you would be like so much, you're still young,
Right.
You would be much younger.
Right.
At that age, you want to make money, you're even thinking of coming to America, as used to be a dream of so many youngsters, and especially in that field. What really, held you back there, and why, helping children? Like, is there any personal story attached to your life?
There are my mentors, the Dr. M.T. Mehta and Dr. Bharat Bhagat. They are working in that structure in the disabled field. So we are very keen to work in this disabled area, and from there we have started our journey for the NGO. Meantime, our colleagues, they are working in the US in a Cincinnati pediatric orthopedic surgery, and they have contacted us and they have supported us like anything. Since last 12-14 years, the Cincinnati pediatric orthopedic department, every year they are coming to the Ahmedabad and treat this type of disabled children. Every year they are sparing their valuable time, skill, expertise, and the implants and everything. They brought all the materials from the USA. They brought the neuromonitoring, all the systems and the expertise also. They treat within a week more than 50 patients, kids, pediatrics. They are the children's. And they are also operating the kyphoscoliosis. There is a bent spine. There is a child in the small kids, and they are operating this scoliosis operation every year. And we are able to do it since last 12 years, and they are fantastic job doing by this Cincinnati pediatric orthopedic surgery. So we wish there are so many areas of work in the Gujarat state, and there are so many expertise in the USA. They come together, and we will have some collaborative action to treat our rural India. And it's an exchange of ideas, exchange of technique, exchange of skills, and how to help to each other. That's a global our health initiative. That is our wish to go forward in the coming 10 years. That is our wish.
So I have seen so many videos or pictures of little kids, with deformities. There would be a child, with who's totally bent, the spine
Right.
is not even straight. How do you correct a surgery like that?
So
And then how much does it cost? And can the poor people afford it?
You have very good questions. It's a very difficult surgery. Per day, they are doing one surgery per day or 1.5 surgery per day. It's very extensive surgery, very extra major surgery, and it requires so much of skill also. And it's our spine surgeons, our pediatric orthopedic surgeons, they are learning with this US team, and we have a very good collaboration and commendable position to treat such type of patient in our India and in Gujarat. It's totally free for our patients.
Wow.
And it's a wonderful experience with the US people, our friends, the doctors team, and our doctors team also. And it's a learning curve. It's an exchange of ideas between the two parts of the globe. And it's a fantastic thing. Right now, there are so many other teams are coming to our civil hospital in Ahmedabad also for the bladder surgery and urinary tract surgery. Now, our wish to collaborate such type of activity in USA so that they can have a good advanced technique, the knowledge sharing base, and as a part of that, we would like to have a good health globe improvement, and it's a good collaboration between the two parts of the world. That is our wish.
Of course. Talk about the deformity correction technique and how it works, international collaborations, given that you've been doing that. So talk about that.
They are doing the huge, long, extended surgery. The basic thing is they open the spine, they correct the methods, and they put some rods and screws, and then they make the spine vertically aligned to have a better hump and better spine for the better gait to prevent lot many complications in the future life. This is a wonderful surgery and an extensive surgery that will change the whole life span and the life skill and life efficiency. Both the way.
Also,
it's
yes.
a very unique surgery, and they are doing a very wonderful job. And our orthopedic surgeon, our spine surgeons are doing fantastic job, so that we can have advanced workshop, advanced technical knowledge, exchange of ideas. It's a learning course for our medical graduates, our medical students, the doctors, and good things for us. It's a fantastic things.
So when you talk about collaboration between Gujarat and USA, what exactly is USA's role and what exactly is Gujarat's role in that in terms of clinical research or manufacturing of the tools that go into the surgery?
There are so many things in medical science. It's an advanced, it's a moving science. It's not an 1 + 1 = 2, but it's a moving science. And we think in our India and our Gujarat, there is a lack of knowledge and lack of awareness about the clinical research spectrum of our medical education. So we would like to know from the US people and US doctors and the US department so that they can educate our youngster, our junior doctors to promote such type of clinical research, how to do it, what are the fundamental things, what is the methodology, how it can improve our health structure and medicine in the future for the longer year. These are the things that lacunae or in deficit in our Gujarat and India, so that we can request our colleagues from the USA how we can have some collaboration between for the clinical research, clinical trials, and lot many things to improve. There are so many things now in Gujarat. There is iHub, it's an institute for the medical innovation and startups. We have started in Gujarat.
Wow.
And we promote our medical graduates and young doctors also for the medical innovations. There are so many things coming in the coming future. These are the things which will attract our young doctors, our medical students, what to do, what is the innovation, what is the medical innovation, what is the startup, how to do it. We are planning to do Shark Tank like the workshop and the competition, so that the young doctor have some good imbibe lateral thinking and how to improve over the medical structure. That is our wish for the longer year.
You've traveled to the USA and Canada to bring new methodologies back to India. What are some of the most impactful techniques or practices you've learned, and how have you implemented them here?
The basic fundamental things in USA and Canada is the protocol for each and every disease and all the treatment. The protocols, SOPs, what is the fundamental things in basic science, we have all the data. Our students are very energetic and intelligent, but to refinement for our medical students and young doctors is most important part. In USA, all the protocols for the treatment, management, diagnostic tool is wonderful thing, so that we can imbibe both the things, intelligence with some protocols that make more sense for our young doctors and junior doctors. That is our wish, to have collaboration between this part of the university and Gujarat, all the universities, and have a more refinement of the medical science and education that will help in a longer way to the whole globe, whole country and the whole state. That is our vision.
Wonderful. You've been involved in organizing events like All Gujarat CP Sports Competition. How important are these events in raising awareness and support for disabled individuals in our communities?
These are, first I should correct the word, they are not the disabled, they are the differently able. That is the nomenclature across the globe.
True.
They are different people. They have different potential for the different energies in their strength, they are the core strength. So to support such type of differently able kids and the children, and to promote such type of activity in the society, then their families, their near and dears and the kids, they have tremendous confidence in their life. To bringing from the ground is our motto. Bringing them through into the mainstream, that is our motto. They live very confidently in a society, that is our motto. They are differently able. They have very intelligent people, they have very bright future. At present, we have to, as a society, and we have our community have to support them for betterment for their life. That is our motto.
And we did brilliantly in the Paralympics too.
Right, that's true. Absolutely. The more gold medals are achieved by our differently able persons rather than our normal sportsmen, we are proud of that. And next Olympic, we can think over more and more medals are coming from this group of the people. That is our wish. They should have a normal philosophy, normal thinking, and they are in a normal stream. That should be our vision. That is my desire.
As the incoming president of IMA Gujarat, what are your primary goals for your tenure, especially concerning public health and community service? Very
good questions. Since last 2 years, our legendary person, Dr. Ketan Bhai, they say have a dream vision for the Aao Gaon Chale project. Initially, it was started in 2004. Now it is relaunched in the last year. And nowadays, in the last year, we have adopted 100 villages across the Gujarat for the whole year. The local branch, we are 36,000 doctors under Gujarat Medical Association. We have 100 local branches across the Gujarat. Any part of the Gujarat.
You said you've adopted them.
For this branch, we have adopted 100 villages across the Gujarat.
What does that mean?
The adoption means for the whole year, we are going to do their preventive counseling, preventive medicine, correction of anemia, clean water, hygiene, adolescent education, menstrual hygiene, education to the adolescent girls, all the types of the preventive aspect as well as the therapeutic aspect we are doing the free of charge across the year in 100 villages in the Gujarat. And we are proud to see that last year we have achieved the first prize from the IMA headquarters from Delhi. But it's not a single event. We should continue such type of activity for the next 3 to 5 years to adapt the village and give our better service, free of service to the each and every village, and give a more, our main focus is on the preventive aspect. The anemia, the basic problems and hygiene and everything. And we are treating the free of cost, they need any disease management, also we are treating them. That is our beautiful program across the Gujarat. And we request our colleagues from the US also, you can join with this our mission Suppose you want to do it, your activity in Ahmedabad or Baroda or Surat or Dang or Banaskantha or any part of the Gujarat, in any district, come together, have a good time with us, treat the patient, educate them well, preventive some activity, correction of the anemia, some thyroid problem, gynec problem, adolescent problem. There are lots many challenges in our Gujarat. And we make as a team, from the Gujarat team and the USA team, and make a good environment in Gujarat. That is our vision for the next year. And we can have some confidence that there are lot many doctors across the Gujarat, across the USA. They will join with our mission to help this Aao Gaon Chal project. That is our main wish for the next year.
I must say you're a great ambassador for medical tourism for Gujarat.
I've talked with our stalwarts of the Dr. Sudhir and so many doctors. Why can't we have a vibrant medical program, a vibrant show in the next year, so that we have invite all the peoples from across the globe and across the world to have a common platform and make a vibrant medical summit and have a beautiful program for our Gujarat, and particularly the need of the persons, the need of our rural part, need of our medical education and young doctors. They have some exchange of ideas in a common platform. That is our wish for the next year also. We should concentrate on the medical tourism also. There are so many things nowadays in Ahmedabad and Gujarat. There is a very good infrastructure of the hospital, very good quality of the hospitals, very good doctors in Ahmedabad and Gujarat, and good infrastructure also. They are very skillful, and everywhere it's a very win-win situation. In USA, there are some patients or some person they don't have any insurance. There are so many doctors, their parents are living in Gujarat and Ahmedabad. So our medical tourism, how to develop this medical tourism, that is our vision also. How to develop this type of activity, we are thinking over the time to discuss with such type of things with both the parts of the country, and how to help with each other and make a more sustainable industry for the medical tourism. That is our wish. There are so many things. It's a planned surgery like bariatric surgery, IVF surgery, LASIK surgery. There are many surgeries that can have a very expertise in our Gujarat and India, and how to help to each other in the US people, and some person have their relatives in a Gujarat or in a part of the Ahmedabad. We can have a good relation with both the part, so that we can have better medical tourism policy in future. That is our wish.
Wonderful. Do you have, when you talk about the family structure, how are families nowadays in India, or say Gujarat particularly, are the old or the senior citizens still part of the family, or are there old age homes for them, and you will be taking care of the whole atmosphere there? How does it work?
So we have talked with so many doctors and so many persons. They are residing in the USA. Only thing, they are worried about their parents.
Yeah.
Everywhere they are worried about their family, extended family. So we requested them to just give the data that your parents or your family, extended families are living in which state, which part of the state, which city, and we can connect with them, so that you can have a better placement, one type of confidence for your level, and we can offer them a very good preventive as well as therapeutic needs sometime arise during that part. Then we can give a better health structure, policy and treatment in Ahmedabad, Surat, Baroda, Rajkot, anywhere in the Gujarat part. We can connect with them, and they have very good confidence. That is our wish, to make your family, those who are living in Gujarat, we can support them as a medical treatment and management, so that our US part, the people, they have a sound of sleep and they have good confidence in the Gujarat. That is our wish. How to connect? We are planning, and they give the data, and we can connect with them any part of the Gujarat. That is our next program.
And also, if you could have some volunteers go to their homes, talk to them, it's so much about mental health and feeling better, having someone to talk to.
Absolutely. There is a need. Someone from the Gujarat connect with their parents or their extended family, they can feel very good at that level. And counterpart in US people, the doctors or any other person, they are working in the USA, they can have a sound of sleep, and they have some confidence because someone is there to take care of my family and my parents.
That's true.
That is the best part. That is our wish. And how to connect that, we'll plan it out and execute within a year. That is our planning.
Okay. I see you guys are so energetic. You have so many doctors fighting for the cause and volunteering your time and resources. Do you think your energy is par with what the government could also help you with, say clean water, good roads and facilities, infrastructure, good air, everything? Like how is it like hand in hand,
Hand
or
in
is
hand.
it like
It is always a win-win situation.
Okay.
There should not be any competition with any authority. And fortunately, we have a very good good governance at the Gujarat state level. We have a good guidance from our Chief Minister Bhupendra Bhai Patel, our Rushikesh Patel. They are guiding us very well. And it's
Wonderful.
an hand-to-hand activity. Some parts is taken care by the government, some parts by the NGO. And our role is to make a bridge between this NGO and this government of Gujarat. Ultimate goal is our on the single one agenda. How to make our life in our rural parts safe, healthy, and they are going to stay healthy and wealthy. That is our vision. And we are the facilitator. As a doctors, as an NGO, as an Indian medical institution, we are the facilitator of the activity of the medical education and the service in the health activity. And we have good response and we have good guidance from the central line, and the government of Gujarat is also there.
What is the percentage of educated population there?
It's a good population. I don't know about the exact percentage wise, but it's a good understanding at the rural level and urban level, both the level. Ultimately, we have
They
to
should
guide
be
them.
accepting
Accepting
whatever.
the things. They have a
Yes.
good acceptance rate. Every preventive aspect is a good activity, and prevention is better than cure.
Yes, that's your motto, I know.
That is the main our motto. How to prevent the disease, how to improve their health structure, how to improve their basic need in our health structure. That is our main mission.
Wonderful. You have a special interest in geriatrics. What are some of the common orthopedic issues faced by the elderly, and what preventive measures do you recommend?
There are so many problems in the senior citizen. The basic fundamental thing is their bone structure. There is known as, in our terminology, osteoporosis. So we are taking so many lectures. What are the things to prevent the osteoporosis? There are in the senior citizen, in the geriatric practice, in the geriatric age group. Ultimately, our aim is to prevention of the fall and prevention of the injury. That is our main need. We don't intend to have an injury to the senior citizen. Our role is to maintain your physics, you maintain the exercise, you maintain the diet, you maintain your weight, and how to prevent your fall during your last innings of your life. That is our mission. We are deliver our lectures. There are some workshop, how to do it, what are the things, basic things in your home environment. These are the things we are taking all the way to the lectures and seminar and educate our senior citizens for the prevention of the fall and prevention of the injury. These are the very small things, but it will give a better help to our senior citizen club and senior citizen age group. That is our main thought.
Wonderful. Would you like to add something to this talk of ours? You were here in US talking to various hospitals and doctors. How fruitful has it been?
It's a very beautiful experience during the USA. We have talked so many doctors in our groups and colleagues. Basically, fundamental thing is how to improve our health policy. Suppose right now we have something percentage of infant mortality rate. We have some problem of the maternal mortality rate. There are some indexes in our health structure. How to improve? What are the things that we want to learn from both the part? And ultimately, our goal is to make our nation and Gujarat state healthy. What are the things that we should improve in our policy? How to diagnose? How to do it? That is the exchange of idea from both the side. And we have talked for so many doctors and our colleagues, and they have invited us, and it's a hand-to-hand commitment. And ultimate goal is to make our nation good and cheerful. That is our mission. It's a clear commitment, commendable commitment, comfortable, and it's a unique case for both the part to learn something from the USA. They also want to learn something from the Gujarat. It's a collaboration between the two parts. It's make our global very clear message and for our nation also.
Okay, thank you so much, Dr. Shah,
Thank you.
for coming here, for your time and doing such commendable service in Gujarat.
Thank you, madam. Thank you.
Thank you.
Thank you. Namaskar.
Namaskar.
Namaskar. Namaskar.